Good afternoon, everyone. My name is Byung-gu Kim from Yonsei University Severance Cardiovascular Hospital. Today's my talk is the effect of wire gelling and side branchy and one-stent strategy for coronary bifurcation lesions. This is my disclosure. Let me start with the LAD diagonal bifurcation case. For the treatment of diffuse long LAD stenosis, 2 DS were implanted with overlapping. However, on angiograms, diagonal branchy was occluded after stenting. We tried to save diagonal branchy from the start of the wiring to the gel diagonal branchy, but finally failed. To protect the side branchy during bifurcation PCI with one-stent technique, numerous strategy has been developed on the basis of wire gelling. It is recommended gelling wire technique in bifurcation PCI, but concerns still remain, particularly data regarding the impact of side branchy gelling technique for bifurcation PCI with one-stent technique using second-generation DES are limited. Thus, we recently reported the analysis regarding the role of wire gelling at the side branchy and the major determining factor for side branch occlusion after stenting using the data of the COVID-3 registry. COVID-3 include patients with bifurcation undergoing PCI with the second-generation DS implantation. From COVID-3 registries, a total of the 890 patients with bifurcation PCI using one-stent technique were finally enrolled and classified into 2 groups according to whether they underwent wire gelling at the side branch, the wire gelling group and non-wire gelling group, to investigate the pure role of the side branch wiring in one-stent strategy. Coronary bifurcation lesion requiring side branches such as the first is elective two-stent technique, the second is a side branch predilation before stenting. A significant stenosis, only a side branch without significant main vessel stenosis were excluded in the analysis. Primary endpoint was the occurrence of the final side branch occlusion after main vessel stenting. This is the comparison of the baseline characteristics between 2 groups. There were no significant difference. This is the angiographic and procedure characteristics of both groups. There was significant difference in the location and classification of bifurcation lesion. The wire gelling group compared with non-wire gelling group had higher instance of left main and true bifurcation, with a higher instance of the heavy side branch calcification or thrombus. DS type and the use of the IVUS were also significantly different. On the comparison of the QCA data in the pre-procedure analysis, the wire gelling group had a shorter immediately greater diameter stenosis, longer lesion lengths of side branch, and shorter lengths of main vessel compared with the non-wire gelling group. In the post-procedure QCAs, there was no significant difference. When you look at the angiographic and procedure outcome, especially the occurrence of primary outcomes, the final side branch occlusion, there was no significant difference. In the instance of any overlapped side branch occlusion, also no difference. However, the instance of the side branch flow restoration after overlapped occlusion were significantly higher in wire gelling group. Angiographic and procedure success were significantly different, and there was no case of the broken wire in this study. Regarding the treatment of bifurcation lesion, the wire gelling group had a significantly higher rate of the final kissing balloon part, ballooning or stenting in the side branch and NC ballooning than did the non-wire gelling group. When analyzing the determinant of for final side branch occlusion after stenting, wire gelling and side branchy were significant factor, along with the greater pre-procedure diameter stenosis of the side branch main vessel and lesion lengths. In the analysis of the risk for final side branch occlusion in lesions with significant predictors, the risk of occlusion progressively increased as the pre-procedure diameter stenosis of the side branch and main vessel and the main lesion lengths increased. On RC analysis, pre-procedure diameter stenosis of side branch was 51%, main vessel was 0%, and the lesion length was 14 mm. When comparing the instance of the final side branch occlusion according to the stenosis and lesion length, the lesion with tight side branch and main vessel stenosis and long main vessel lesions show the highest instance of side branch occlusion among the subset. When comparing final side branch occlusion according to the disease severity and wire dwelling and side branch, although the instance of final occlusion after stenting in all patients were not significantly different between two groups, the wire dwelling group had a significant low instance of final occlusion in the lesion with pre-procedure diameter stenosis of side branch of greater than 60% or main vessel of greater than 60%. In the comparison of the instance of final side branch occlusion according to the wire dwelling at the side branch and the severity of the stenosis of side branch 1 main vessel, the wire dwelling group had a significantly lower instance of final side branch occlusion in the lesion with the pre-procedure diameter stenosis of the greater than 60% and main vessel of greater than 60%. However, among the other subset with pre-procedure diameter stenosis of side branch less than 60% while main vessel of less than 60%, there was no significant difference in the instance of final side branches between the group. When you look at the clinical outcomes according to the wire dwelling, there was no significant difference. Ladies and gentlemen, this is my take-home message. In overall bifurcation lesion treated with one stent strategy, wire dwelling at side branches was not associated with reduced risk of final side branch occlusion. That means the routine wire dwelling at side branch does not need to be recommended. Wire dwelling at side branch before main vessel stenting was a protective factor against the final side branch occlusion after main vessel stenting in one stent strategy, especially in the lesion with the pre-procedure diameter stenosis of the side branches greater than 60%, main vessel greater than 60%. Wire dwelling was significantly associated with low instance of final side branch occlusion than non-wire dwelling. This suggests that the beneficial role of wire dwelling for specific lesion subset is meaning the severe stenosis of both side branch and main vessel stenosis or true bifurcation in the wire in stent strategy. Thank you for your attention.